So very good afternoon to one and all. And this session, I would like to thank AIOC and Dr. Purvasha for this opportunity. And today I will be dealing with wet lab models for corneal surgery and ocular surface surgery. So to be an accomplished surgeon is the dream of every ophthalmologist, and the sooner the better with least effort. That is what we try and achieve. And in case there are these hindrances in the journeys, they could be tips and tricks to overcome them. And as we know, there's a generalized lack of human donor corneas in general, and following the pandemic again, there has been a scarcity of tissue. So the backseat, the corneal training in specialized surgical centers has taken a backseat, and just to promote surgical training again, there are tips and tricks in the form of tools like wet lab and dry lab models, simulations, and synthetic models, which utilize either human discarded tissue or animal models, or artificial intelligence and virtual reality simulators, which can be used, and this training can again be brought to the forefront. So I shall be presenting some of these wet lab models that we have devised, especially for complex surgeries like DMEC, and in which we know that it is a very delicate surgery involving 10 to 20 microns of that membrane with the endothelial complex, and the dealings with it are to be very delicate, and they need to be, for the success of the surgery, with minimal endothelial cell count, we need to be very adept with the skill set. And the main three areas where we have to take care is preparation of the graft tissue, injection into the anterior chamber, as well as its dealings of unfolding and centration within the chamber itself. So based on these tools, we have also published certain models, and this is the humble onion that we have in our kitchens, which we have devised as a tool for practicing DMEC. As you can see, you can just take a peel and you can place it on the Teflon block, and it actually, you can practice partial thickness trepanation. It stains almost like the human tissue. It peels off just like that, and it can actually be a good simulator of the actual dealing and the tactile reflexes that you have to develop. And this is the stamping going on. You can actually practice the various letters P, F, S, L, whatever suits you, and then place back the cap and then immerse the tissue. It even scrolls like the normal human corneal tissue. So all this can be done. You can even inject it into the anterior chamber using the injector, and then practice the various maneuvers within the practice eyes, artificial eyes. So another model that we developed for the dealings of the desmus membrane endothelial complex within the inserter, to understand what will be the orientation, is this large beveled syringe or a glass syringe, where we have placed a plastic sheet with the endothelium printed on one side along with a P-marked stromal endothelial side. And if you inject it with the bevel down, the stromal orientation is correct and the P-mark comes up and the endothelium is on the bottom side. Whereas if you inject it upside down, this is what happens, and then the endothelium is upside, and this, as you can understand, this is good to demonstrate to your trainees. Next, we come to the dealings with the anterior chamber. The fluid waves and the entire DM being inside the chamber requires a different skill set of handling the graft, and this was published as the DMEC aquarium that we named it. And this requires the filling up of a plastic balloon which is transparent, and there is a plastic sheet marked P inside it which simulates the graft within the anterior chamber. So if we see in the human cornea, all the manipulations which are needed can be practiced with this kind of a model, where here we are practicing the unfolding by pinning on one side and then opening with taps, gentle taps with the cannula on the other side. Next would be the movement or the centration of the graft using the ripples, the tiny minuscule waves produced with gentle tapping with two cannulae. And here again in the aquarium model, the graft can be placed or centered from one side to the other using these ripples. Next we come to the waves, or these are the bigger water fluid convections, which are creating the waves for centration. Now, another model after this that you can practice is the artificial anterior chamber with a piece of latex glove which has been mounted on it, and this can serve, after placing the discarded corneal tissue on it, this can serve as an artificial anterior chamber, and you can practice all the maneuvers of dosa, the chapati, whatever rolls or the scrolls are formed, you can practice the unfolding as well as the centration. These are the DMEC Wetlabs. Coming over to the ocular surface surgeries, you can practice SLET. And here we have mounted the goat's eye tissue on this suction platform, which has been customized. If it's not available, you can even use the thermocol pad and pin the tissue over it. And here we are practicing multi-layered amniotic membrane grafting. This is the Teenham's patch grafting. You can learn how to assemble the keratoprosthesis and then also practice how to suture it into place in the goat's eye model. This is the penetrating keratoplasty, the DSEC model, the DALK model, conjunctival graft, LASIK microkeratome. The corneal suturing can be practiced by trainees and fellows, corneal tattooing. All these can be managed, and even the eye-bank technicians can be trained for after the enucleation, then they can create CS or the corneal screen rims using this practice tool. And the setups are very simple to make, and these are available everywhere. The very specific one that I would like to talk about is the pig head model, where we may have made trainees practice mucous membrane grafting, where it simulates the lid margin dissection as well as the oral mucous membrane grafting as well as the suturing of the graft onto the eye. That's our hero, the pig head, and that's converted into a celebrity and can also be used for other extraocular surgeries. So, based on this armamentarium, I think the journey for surgical training can be eased out. Thank you.
Thank you, Dr. Purvasha, for this very interesting. This period concept is quite new.